Good day, I'm Leopold Santiago, a student nurse from BSN2C, and I'm here to perform the Leopold's maneuver, fetal heart auscultation, and Fundic height measurement. So let me tell you first what you need to assess. The first one is to determine the need for Leopold's maneuver. The rationale for that is the procedure is preferably performed after 24 weeks gestation when the fetal outline can be palpated already. If it's not yet the right time, then we will not get the result that we want. Second is to assess the client's overall condition and determine when was the last time the client voided or was tested for urinalysis. The rationale for that is that the procedure includes palpating the abdomen that may trigger the client's need to void. We also need to determine the immunization history to check if the pregnant woman is safe from tetanus neonatorum because of tetanus toxoid immunization. The next is to ask the client if there's a history of abnormal fetal presentation in the family during pregnancy. To know what to expect during examination and if there's a risk of pregnancy, delivery, and labor. And the last is to know the last menstrual period and the expected date of confinement. This will serve as a baseline data to make sure that the measurements are correct and the fetal growth is okay. The next is planning. We need to allow adequate time to prepare for the procedure. The procedure must be performed during antenatal checkup. The antenatal checkup is monthly or weekly checkup of the mother. So the first thing that we should consider is to check the baby's heartbeat and the fetal growth to determine its well-being. So the equipments needed in the procedures are stethoscope, measuring tape, draw sheet or top sheet, and antibacterial hand spray. After making sure that all the equipments needed are already prepared, then it's the time for implementation. Now that I'm done with assessment and planning, I'm going to show you how it's done. We have here our client who visited the clinic for her antenatal checkup. Before proceeding to the procedures, we need to make sure if you are about to do the right procedure needed. So check the physician's order to verify it. Introduce self and verify the client's identity using agency protocol and explain to the client what you are going to do, why is it necessary, and how they can participate. Good morning, Ma'am. I'm Leopold Santiago, a student nurse from NAUST. Are you Mrs. Fame Hiren Santiago?
Yes,
How are you feeling?
I'm good.
Thank you. So I'm here to measure the Fundic height to check how many weeks you are pregnant, Leopold's maneuver to check the position of your baby, and I will check the baby's heartbeat. All you need to do is lie down. It will not hurt you and your baby, and it will only take a short period of time. Is that okay with you?
Yes.
Thank you. Provide for client's privacy by drawing the curtains near her and ask the client to empty the bladder before the procedures. Do you want to go to the bathroom before proceeding?
No.
Perform hand hygiene and observe appropriate infection control procedures. Position the client in a dorsal recumbent position and then place a pillow under the head for comfort and place a rolled small towel or pillow under the client's right hip. Ask the client to be still with arms on the side. Position the client in a dorsal recumbent position. Place a pillow under her head. Make sure that she is not laid flat on the bed because she is at risk of supine hypotensive syndrome. Mom, just stay still, okay, while I'm doing the procedure. Thank you. Drape the client with draw sheet exposed from below the breast to the symphysis pubis. So now I'm going to expose her belly Inspect the client if she has scars, diastasis recti, hernia, linea nigra, striae gravidarum, contour of the abdomen, and state of the umbilicus and skin condition. So I'm going to get the measuring tape and I will use the centimeter side of it. Measure the fundal height using the measuring tape. Place the zero lines of the tape on the superior border of the symphysis pubis. Woman, the measurement is 36 centimeters, which means that the age of gestation is 36 weeks because they correlate with each other. So let's move on to the Leopold's maneuver. Instruct the client to relax the abdominal muscles by bending the knees slightly and do relaxation breathing. Reinforce the explanations given earlier. Use the flat palmar surface of fingers and not fingertips and keep fingers of hands together. Apply smooth and gentle deep pressure as firm as necessary. So the first maneuver is stand at the client's side and face the client. Palpate the fundus using both hands. Curve the fingers around the uterus top and feel for the fetal part lying in the fundus. Use the palm, palpate for size, shape, consistency, and mobility of the fundus fetal part. The purpose of this is to determine fetal part lying in the fundus. The head is firm, hard, and round, while the bottom is squishy, tiny, and less well-defined. It is very important to make sure that the hands is warm, so I'm going to rub my hands together first. I'm going to take my hands and make a little triangle and face the mom's face, and I'm going to palpate the top of the fundus. So that's the first maneuver. In this client, the fetal part lying in the fundus is the bottom. So the second maneuver is place your hands on either side of the client's abdomen, about midway between the symphysis pubis and the fundus. Move the hands on the sides of the abdomen, with one hand in place to steady the uterus. Use the other hand to palpate the uterus opposite side with the firm, circular motions. Repeat the maneuver on the other side of the abdomen. The purpose of it is to identify the location of the fetal back. The fetal back is smooth and hard, while the knees and elbows is with a number of angular modulation. I'm gonna place my hands on the sides. I will use the left hand first for support while my right hand is palpating. This pregnant woman, the fetal back is on the right side. So that's the second maneuver. This is important because we will auscultate the fetal heartbeat using the fetal's back. So the third maneuver is continue facing the client, grasp the lower abdomen portion, immediately above the symphysis pubis, between the thumb and middle finger of your hands. The purpose of it is to determine what fetal part is lying above the lower abdomen. And if it is the head, then the engagement is assessed. It is not engaged if it is movable and engaged if it is not movable. I'm gonna make an L-shaped finger in my hands, place it close to the symphysis pubis, first maneuver, I palpated the bottom at the top of the fundus, so using third maneuver, it will validate my findings. In this pregnant woman, I palpated the head, so we will now have the idea that the baby is in cephalic presentation. I lifted the head so it is movable, and that means that it is not yet engaged. So the fourth maneuver is Face the client's feet and place your hands palmar surface on each side of the client's abdomen. Use both hands and palpate fetal head by pressing downward gently with your fingertips about 2 inches above the inguinal ligament. This maneuver is performed only in a cephalic presentation. The purpose of it is to locate the fetus brow if the fetus head is well flexed or extended. It also determines the fetal attitude and degree of fetal extension into pelvis. So in the last step, I will face the mom's feet and I will start at the bottom and start palpating. Nandito ko na. Head is well flexed, meaning the baby's chin is tucked down towards its chest. So that ends our Leopold's maneuver procedure. After knowing the position of the fetus, we're now at the last procedure, which is auscultating the fetal heart. Make sure that you have your stethoscope with you before proceeding. So in the fetal heart rate auscultation, place the bell side of the stethoscope chest piece on the fetus convex portion, closest to the anterior uterine wall. The bell side of the stethoscope is used for low frequency sounds. Listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. Now that we are done with all the procedures, say thanks to the client. So ma'am, we are now done with all the procedures. Thank you for cooperating. Document the procedure including the test performed and results in the client's record using forms or checklists supplemented by narrative notes when appropriate. Notify the healthcare facility responsible regarding the results and inform the client regarding the findings. Perform a detailed follow-up based on findings deviated from normal or expected for the client. And lastly, teach the client on how to do a proper follow-up and provide other appropriate instructions.